Partners in Health came to Lesotho to address the current needs in Lesotho, which is basically to provide health care for the poor, especially up here in the mountains, in the remote areas where people don't have access to health care, especially now with the two main problems that we have, the HIV problem plus the TB problem.
And it's a difficult thing to do. It's simple to say, well, we're here to provide integrated modern healthcare services to poor people, most of whom have never had them before, but it's very complicated in the doing. And one of the reasons it's complicated is there's no electricity. There's the clinics that are up there they don't have staff.
We can be able to follow patients up. You see, sometimes you see patients at the health center, they are diagnosed TB, and after the time you expect the patient to come to the health center again for a revisit or a checkup, the patient is not there. You don't have a way of following the patient up. The patient is dead or is just not coming you don't know. So because of a few people we are having, nobody will go out to the village to see a patient, while the actual thing would be for a follow-up. Follow the patient up, see, even if it means he has not come for treatment, to see the situation the patient is living in, to advise hygiene or whatever, or such a thing. So if we are short-staffed, how can we do that? We are not doing the ideal work, we are just doing the work, but not the ideal work we should be doing.
The part of this story that's been missed most by those who study it, the community health workers. Yeah, we need the doctors. There's no medical school in Lesotho, not one. There's probably fewer than 100 doctors here, 80 of them in the city. And, half the population lives out, up in the hills. So huge problem with doctors, huge problem with nurses, but we can get community health workers trained and trained well and have them improve the quality of the care here. A community health worker lives in a community and serves his or her neighbors.
Ka mora o fumana kalafo sepetleleng sa Maluti, re phahama ya ba re betse ke fuwa thupelo go go rupela ba bang go ba tsebe ka boemo ba bona. Mme ka hona thupelo e re thusitse banneng go kgona hore re ba hlabolle hantle. Hobane re tseba boemo ba HIV. Mme ka hona ha re fuwa thupelo, re fuwa re le ditleliniki tsohle tse welang sepetleleng sa Maluti.
The goal is sustainability and to assist the people to be able to take care of themselves in a dignified way.
It was just a year ago in July that there were no patients at any of these clinics on AIDS care. And at Nohana, the place that I flew to today, they've got nearing 400 people on full-blown antiretroviral drugs in just a year.
Le ho hlahloba bakudi ba hae ho ka bophelo ba bona bo lo bona se bo bona se dipidisi ka mokgone ba etseng le nako e le re dumelane ka yona le mokudi.
The biggest concern with antiretroviral drugs, a very complicated regimen of medicine every day for an entire life. You don't have a break from it. There's no, so you have to have people who can follow up. And what's been really cool is to see the families and the villagers and everything kind of get around the people that are sick and work together.
Di butshintshile baneng ka nnete ke phela ha monate hona jwale. Re kgothaletsa hore motho mo le mong a tsebe boemo ba hae bane ke yona tharollo ya bophelo.
fela ga ke letsapo le misa ke sebetsa mosebetsi wa lay counselor ke ratile ho ithaopa baneng ke rata go setjhaba sa setso sa Basotho se phele hantle mme le naha ya bo rona kapa lefatshe la bo rona la Lesotho le ska la timela ka le nako go le yona yohle e re ha bolela dinaha tse teng lefatsheng le naha ya rona Lesotho ne hlae
le ga se ke tlile go tsamaya o na le tshwaetso le ena ke ga di nwa dipidisi he le ena bakeng sa dithuso ne ke le motho a sokolang wa ne ke kula ke sa tsebe etsa letho go sena motho a nthusang ka nix ke a lo ka sepetlele he ke ka ntse ke ye ke phaka treatment ke tlola le ho fumana gona ke etsa jwang ke a lo re sepetlele sona se ne se nthusa ka nthongolong ka dijo tsa mbatla le motho a nthuse ka bana a mphehela ke tse nthongolong le dijo ne ke di tholana ka teng me di tholana ka teng ka sepetlele tsang ba tsa ka tse ke di jang le tse eno a di fumanang hana le menyane ba nna sa nyanye le motho a nthusa lapeng mona ho sebetsa ho khono ke be bitiri la ke ba bitiri he ke ha motho no twa tlwe thuso ntse di hospital ona jwa.
We are also aware of the harsh reality of the poverty here and the real starvation that we see in this place. So we don't just give them treatment and let them go home. We also have a food program which we actually get from the WFP, the World Food Program. So all our patients who are on chronic treatment, namely TB treatment, HIV treatment, when they come for their monthly follow-ups, they also get some food. And the food that we supply is actually adequate for the whole household. So we are not only addressing health issues, but we are actually giving a broad way of care, which is basically to take care of the nutritional needs as well.
Not only are you taking on the healthcare crisis, you're taking on the personnel crisis by saving lives and bringing people into the work.
What gives me the most hope for this country is that people in this country are not afraid to deal with this epidemic. We are prepared to face it, test, and make sure that every person is going to get the care and treatment that they deserve.
Ke mme Mampoi o sebetsa go UV go loga ha na mo ga ga ba patala 10 ranta ka mana ka muso.
The government of Lesotho has increased access to health care to as many people as possible by dropping the price to 10 maluti. 10 rand is roughly $1. And for that, you get consultation, drugs, investigations. You can even see a specialist. We are given TB drugs for free. We are given antiretroviral drugs for free to pass on to the public.
We should still stress a lot on prevention, because if we do not stop the flow of water, it will keep on flowing. So we have to stop where the water is coming from. We have to stop the cause of AIDS so that we take care of those that are infected and affected, and to show that we are having few new cases of the disease.
Our teacher told us that HIV is an incurable disease.
In terms of HIV care, we are trying to train as many people as possible to care for children with HIV, particularly nurses, because at the health center level, they're generally the ones who are the providers.
The economic status of this country is the biggest challenge, and the fact that we are not training most of these professionals in the country, you will realize that most of our programs are nurse-driven initiatives, whether it is HIV/AIDS care and treatment, whether it's TB initiative. Apart from surgical initiatives, really, everything else is a nurse-driven initiative.
We have reached the stage where we are saying for non-complicated cases, nurses can initiate ARV therapy. This is usually reserved for doctors, but we are saying our nurses we have adequately trained can do it, and that's how we have been able to improve on access.
Manuel, can you please report yourself at the reception? Manuel, can you please report yourself at the reception? Thank you.
My name is Dinam Tahane. I work at the Baylor Children's Clinic in Maseru, Lesotho. Here at this clinic, we take care of children with HIV. Kids come in, they get tested. If they're positive, they get enrolled in care at our center. We continue to follow them and give them all of their primary pediatric care as well as their HIV care and their medicines. So our nurses are in the midst of a course learning about care and treatment of kids with HIV. We're trying to get as many nurses as we can trained in the care of kids with HIV. There just aren't enough doctors to be able to staff all the clinics, so most of them are staffed by nurses. During their training, they get a lot of training on primary care for children. They do immunizations. They're the ones that see the kids on a regular basis. So basically throughout Lesotho, that's how a lot of health centers operate.
Government is decentralizing. In the ministry, we have tried to decentralize for a very long time. My understanding is that that will empower communities even more, so the partnership will be strengthened.
The Lesotho government initiative of having nurses initiating treatment is working beautifully.
This is really a nurse-based system, and you need those three pillars, community health workers, nurses, and docs, working in a team together, and the docs and nurses need management skills and public health skills as well as clinical skills.
We are currently, as of now, working on an emergency human resource plan because we have reached crisis level.
What we need to do is make a few changes, make it a focus of the government of Lesotho to make sure that they keep the retention packages are attractive. The Boston University team that is here in Lesotho, and that is that's what they have offered to assist the government of Lesotho with, to make sure that we devise packages that are very attractive to our young people, and also conditions of service that are also attractive.
Our program is dealing with how to bring more doctors back to Lesotho. There currently is not now, or ever has there been, any kind of specialty training program in the country of Lesotho. This will be the first residency specialty training program. It's geared towards training doctors to have the knowledge, skills, and attitudes to be excellent district doctors.
My name is Bokane Tlotlo. I'm from Maseru, Kwading, and I'm studying in the University of Free State in Bloemfontein, and this is my 4th year in medicine.
We've identified about 65 students who are in medical schools, mostly in South Africa, but around the world, and we're working hard to contact them, to talk to them about the program.
We had a meeting with the physicians at home. They told us, you guys, we really depending on you now. So, it's upon us now to see that we make it better.
What we found is that many of them would like to come back home if some of these issues were addressed. That is, that the salaries isn't everything, but the salary has to be somewhere between where Lesotho is now and where South Africa is. But they also tell us that the hospitals need to function better. If everything else is equal, and not even equal, if things are just close, a lot of the students have said they want to be home with their families in their own country to help their own people.
I have a family here, so if I can be able to put
a plate in front of them every day, I'll definitely come back home. Oh. Come here.
We probably will never compete with our neighbor or the countries that are attracting them, but we believe that talking to them, we would be able to attract a lot more who would be willing to stay, provided they can meet their own basic human needs and their families.
We are hoping that by aligning with a well-known university like Boston University, it will make our people understand, because, by the way, education is a major priority in this country. Everyone wants to be educated, everyone wants to be aligned with a well-known university. So we feel our residents will see this as an opportunity of actually coming back home, because they will value being part of this program.
The working conditions are slightly better, and I can see, and I'm optimistic that things will get better.
Part of the program is training doctors. The other part is working in the district hospitals to improve the quality of the district hospitals. Because if district hospitals work well and there's no doctors, that doesn't work. If there's well-trained doctors and poorly functioning hospitals, that doesn't work. The brilliance of this program is that we're doing both, the public health of improving the hospitals, the clinical training of working with doctors, and bringing those two things together. That, I think, will lead to a sustainable change.
Just one doctor, one nurse for a few thousand people. You get everything set up and put people on therapy, and you see these people who look like skeletons when they come in. You don't recognize them just 2 or 3 months later. And then maybe you could give them a job, and they could work together on this effort.
We've got a huge crisis on our hands. We got 3.5 people dying every hour from AIDS in Lesotho. Right now, they've got 2 people died every one that's born. We have a possibility of an extinction of an entire race in 45 years because of the demands or the dangers of this disease. So it's all we can do to try to make a difference now. It's a race. It's a race against time.
There is hope in this place. There is a desire. We do have a zest and a zeal, despite whatever shortcomings we may have had in the past, but we are willing as a nation and as a health system to pull up our socks and to attend to the people, be it sick or be people who are well, given that the best kind of health system is that which does not only cater for the sick, but even to prevent, to cater for the well-being spiritually, psychologically, socially, and all otherwise.
If people in Lesotho cannot be taken care of by their own people, it's an embarrassment. So I'm sure they're going to rise to the occasion.
It takes time to change, but I think we have at the moment the right people who are engaged in changing.
It is my desire for you to know that there are those in the past who have come out of Lesotho, or even our fellow Basotho, who have sacrificed themselves for this country. And I just wish to appeal to those of our colleagues, be it medical students or graduated doctors or even postgraduate specialists or consultants, wherever you are as Basotho, we need you in Lesotho. We need you to come and recapacitate this particular place and to encourage the rest of those who are serving the Basotho people here to continue doing their work.
People define success differently, I know that. Other people define success based on the amount of money they have in the bank. But if we go back and go to our African way of thinking, remember what importance in the community is all about, the contribution that you can have to your community. That's what we use to gauge success. And I think, and I still want to believe, in the true African sense of the word success, which is the contribution that I can have for my community. I think that's a reason that's keeping me here. And I hope there will be someone out there who shares the same values as me and who will frankly watch this and come back.